I make joke of it and I say I help tired women. Aren't we all? Exactly. So I'm like, well, I help tired women. And so I look at the hormones and the other thing that I think we don't talk a lot about is that we've come to accept menopause as, well, it's is what it is. There's nothing we can do. But the fact is a lot of women are getting heart disease once they hit menopause. Once you lose that estrogen protection, the risk of heart disease just doubles.
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here. Hi, everyone. Welcome, welcome, welcome. Welcome to another episode of the Care Room with Dr. Cindy. I have another wonderful guest with me today. So I have Dr. Ruth Odoi with me today. She's amazing. She's awesome. But she's here to share her wisdom with us. I'm just going to let her introduce herself first before we get into it. The floor is all yours, Dr. Ruth.
Yeah, thank you so much, Dr. Cindy, for having me. I am so excited to be here. So my name is Dr. Ruth Odoi. I'm a board certified trained in internal medicine. I also have some training in public health. So I have a master's in public health, and I am currently getting a fellowship in anti-aging and longevity medicine. I've also studied some, functional medicine. So I bring different, I guess, perspectives to the table in regards to medicine. And now I'm focusing on women's health. And so I'm excited to be here and to talk about women's health and functional medicine and just medicine. Yeah.
Yeah, we're so happy that you're here with us. I know you're very busy, but can you tell us more about how you got interested or started in functional medicine, longevity medicine? How did that?
Yeah.
Yeah.
So, I went into medicine because I wanted to do preventative care. And
Okay.
so I got my master's in public health, and the idea was to do preventative care. I grew up in Ghana. This is like a big part of our healthcare system, public health and preventative care. But, in residency, being in the resident clinic was not a good picture of how, practicing medicine would be like in the outpatient setting because you don't have enough time, you don't have enough resources. So I just felt like I could not, practice outpatient medicine. So after residency, I went into hospital medicine, which is what I've been doing for the past 8, 10 years now. And so while I'm practicing, with hospital medicine, you end up seeing the fallout of outpatient, like
Okay.
outpatient measures have failed. So now they are in the hospital.
Mhm.
And so you see over and over again where people are like, yeah, I saw my primary care doctor about a year ago and they said everything was fine. Or the story that I kept hearing is I tried to get in, but the appointments are so far out that by the time, even they went to follow up from the hospital, they are back in the hospital again. They were not able to be seen outpatient. So I kept seeing it over and over again that, outpatient care is lacking. And it's not that doctors aren't doing their best, but it's kind of like they are stuck in a system where there's
Right.
just not enough time to really talk about the things that actually lead to disease, which is your lifestyle, and
Absolutely.
stress management. Because, like, any person who goes into a primary care physician office 70% of the time they are facing stress, and stress we know is directly linked to disease, but that's not being addressed when they go in because it's a 7-minute appointment, it's a 10-minute appointment. So I kept hearing that over and over again in my hospital medicine career. And so I said, how can I do better? What can I do differently? And then the statement that I keep hearing in conventional medicine is also, well, this number is not normal, but let's wait and see. And it's
Right.
like, what are we waiting to see?
Right.
And it's kind of like we are trained to see disease and
Right.
not trained to optimize health. And
Okay.
so that really got me digging, and then I found out about functional medicine, that
Sure.
is the study of root cause. And so that really was very attractive to me, so I started doing my studies. And then as I'm learning in functional medicine, I found out also about longevity medicine and anti-aging, so I said yes. So I've been completely engrossed in it and finally decided to open up my practice to do exactly those things.
It's amazing. That's so
Yeah,
exciting, Dr. Ruth. So
yeah.
tell us more about your practice. So you've made this transition from hospital medicine. You've opened your own practice because you want to get to the root cause. Tell us more. Where are you located? Let's start with that.
I'm in Rochester, New York.
Okay. So
Yep.
tell us more. Tell us more about this new practice.
Yeah, so Oasis Women's Functional Medicine slash Direct Primary Care
Sure.
um, is a place where I look it's all women, and I look at root cause. So for instance, when you take one person with hypertension, for instance, we do know that different causes that leads to hypertension, and it might be different in one from one individual to the other.
Sure.
So when someone comes to me with high blood pressure, I'm looking at how, are they inflamed? So I'm looking for, signs and symptoms of inflammation. So I'm looking at their blood work. They nutrient deficient because magnesium deficiency can, increase your risk of high blood pressure because we see magnesium being used in pregnant women when they have, preeclampsia and high blood pressure. So we know magnesium as a nutrient is very important with blood pressure management. Or I'm looking at, is this stress related? Do I need to focus my treatment on stress management and how to reduce their stress? Because I know that once I identify the root cause of their illness, then we can get to the illness instead of treating the blood pressure. How about we look for what caused your blood pressure to be elevated? So, in other words, I'm looking at the disease in the person versus just the disease as a separate thing.
Sure.
So, I definitely want women who come to my practice to feel like this is targeted to them, this is personalized. I am dealing with their root cause. So every appointment is different.
Yeah.
Every appointment is different.
Imagine. Yeah.
Yeah, because for some women, their thyroid dysfunction is leading to weight gain. For some women, it is their hormones that's leading to weight gain. They are in perimenopause or menopause and they are just gaining weight. And it's just so I just hate the language of lose weight. It's like,
Right.
okay, well, I've been trying.
Yeah.
I've been trying to lose weight. Do you have anything more to say to me than lose weight
Agreed.
or exercise? Like, what kind of exercise should I engage in? Should I build muscle? Should I strength train? Should I do cardio? If I should do cardio, how much of it should I do? What is my heart rate? So those sort of details get lost when you are rushed in a visit. And so that's like the picture of integrative medicine here at Oasis. I call it personalized medicine, integrative medicine, functional medicine. I just combine
So
all of my skills and knowledge from different spaces as I've educated myself to help people in that way.
yeah, that sounds
Yeah.
great. I am so glad that you're doing this for the people of Rochester. But can you tell us, like, if you're speaking, a lot of the people listening to us are like women, they are ideal clients. Um, can you speak to them and tell them what they should look for when trying to choose a functional medicine physician?
Well, I like that you ended it with functional medicine physician because there are a lot of functional medicine practitioners out there. And that's part of the reason I went into it as a physician because I want to bring to the picture the knowledge with physiology and anatomy and pathology from, my training in medical school and residency. So the first thing I will warn against is making sure that the person that you are going to for this care is actually trained because functional medicine as it is, most people, anybody can go in and get a certificate and start being a functional medicine practitioner. And so be careful and look at their credentials. Do they have the credentials to speak to you about your anatomy and about your physiology? Because what sometimes it becomes, it's like a writing of supplements and ordering a whole bunch of blood work without clear direction or without clear interpretation of this blood work and what it means for you as a person. And also the lack of training of knowing when things are dangerous and when things are becoming toxic
Right,
and when things are becoming a pathology.
right,
So you need someone with the training who can say, well, right now we've crossed the line of root cause. Let us treat what we see now and work towards finding a root cause. So I have some women come to the practice, their blood pressure is elevated, and I still educate them on the risk of stroke, on the
right,
risk of all the things that can happen when you have elevated blood pressure that is untreated. I don't tell them, here are some supplements, this will help you, you know, that's it. We talk about, okay, let's put you on an antihypertensive, but I'm committed to helping you to come off of this antihypertensive because we can get to the root cause of what caused your hypertension to begin with and we can work towards weaning you off. And
right,
then I also have the knowledge. So you go to someone who has also the knowledge of knowing that there are certain things that you can't play with. If you have this condition, it's unfortunate, but you have to take these medication for life. There are certain things that we just don't have um, any way around it.
right.
For instance, like cancer, yes, can you heal cancer? Can you heal your body with cancer? Absolutely. But it's a big risk that I would not advise people to take. Can you see an oncologist and work with an integrative physician to make sure we optimize your system so that you can tolerate the chemotherapy, one, and two, that your body is optimized so you don't get infections while you are getting the chemo treatment, or that you don't become nutrient deficient while you are getting chemotherapy. So these are all things that unfortunately you have people out there with functional medicine practitioner that they are not able to really guide someone through. So I think you should go to a physician, a PA, or, a nurse practitioner. At least they have some medical background, they have some medical training versus someone who is completely
Absolutely.
passionate about health and have decided to get a certificate.
Absolutely.
You have to go in very careful
Got it.
because it's an unregulated market. Or
I
I'll call it for what it is. Like supplements is not regulated. And so you have to do your due diligence.
got it.
Does that answer the question?
Absolutely. Absolutely. So make sure that whoever you're seeing, um,
Yeah.
unlicensed and, competent in the field.
Correct.
Yeah,
Correct.
absolutely.
Correct.
Absolutely. And any
Yeah.
recommendations for us physicians? A lot of us who are just, quote unquote straight medical, like, we're medicine minded, we're not as focused on the root cause. Any advice for those physicians listening who are open to functional medicine?
Yeah, I think that it is worth reconsidering some of the things we were taught in medical school about supplementation, about nutrient deficiencies, about just being open minded and seeing the data out there and looking at the literature from a critical viewpoint versus, well, the guideline says 20 20 nanograms per, I don't know, deciliter of vitamin D is the cutoff. And so it's okay. Like, I want to encourage you to look at the other big roles vitamin D is playing, because that cutoff is really to prevent um, rickets. And so, like, when was the last time you saw someone with rickets?
Got it.
So, and also leaning into your patients who are seeing a functional medicine practitioner. Don't just write it off, but lean in and ask them questions so that you can be an ally rather than someone they don't want to talk to about a functional medicine practitioner that they are seeing. Because at the end of the day, you are taking liability of their care. And
Right.
so it is in your best interest to lean in, ask your patients, what supplements are you taking? You'll be surprised, how many supplements people are taking, and just being aware of what some of these things are doing and being and educating your patients on the side effects of taking these random things online that they are just buying. So just, going beyond the standard, what are the new medications you are taking? Asking them, are you taking any new supplements?
Right.
It's so important.
I
Just,
Mhm. Yeah. I completely get that. I completely get that. Which brings me to my next question.
yeah,
We can use this opportunity to speak to patients and listeners about the myths surrounding functional medicine.
correct.
Let's bust some of those myths. Let's put them to bed.
Yeah.
Can you help us with that? Yeah.
Yeah, absolutely. So, as a biochemistry major, I see a lot of biochemistry in functional medicine because we are looking at the level of the cell, we are looking at enzymatic reactions, and there is a myth out there, and there's some truth to that myth that functional medicine is all about expensive testing and supplements. And I think it really functional medicine comes down to the practitioner or the person who is practicing it, their style. Now, most people out there have just protocols and they just do the same protocols for everybody. And then there are some of us who are also using it as a tool. It's like another tool in our toolbox
Right.
as a physician.
Right.
Okay, so let's look at your nutrients. Let's look at your diet. Did you actually? So for me, it's meaningful in that way. And I know there are conventional medicine doctors who think it's snake oil or snake oil medicine, and they have different names for it. But I think leaning in and understanding that, okay, I'm not used to this, or we weren't taught this in medical school or residency, but this is interesting. Let me look at what is going on. Let me read the data, because I think we can all agree that our healthcare system is busted as it is right now. Like, so we can all start from there, right? We can all start from there. We can all like have a common ground that
Absolutely.
conventional medicine as we know it right now is not working. It is
Absolutely.
just not working. So if it's not working, why aren't we open to other tools that we can use to improve our patient outcome. So there was a study in the British Medical Journal that a lot of up to more than 50%, I don't quote me on the numbers, but basically there were a lot of people who went to their physician for their yearly checkup and it did not reduce their mortality or morbidity. So there was a point, I don't know if you remember, there was a time where people were beginning to say that those yearly physical checkups were no longer necessary and people were to now extend it to every 3 years, which is terrible. It's like a terrible way to look at the data. It means that what we are doing is not effective. We are not asking patients about their diet. We are not asking about their sleep. We are not asking about stress management, or there are no tools in place for us to do so. In other words, so it's I think people should, or other physicians should have an open mind about what functional medicine is that really it boils down to the practitioner,
Okay.
the individual practicing it. For me, I see it as another tool in my
So,
kit.
so you still
So
practice conventional medicine. It's
absolutely,
okay.
absolutely,
As it
absolutely.
advances your problem.
Absolutely, absolutely. If you come to me and there's a problem, we will fix that problem conventionally, and then we will pull back and try to find out what started that problem. In other words, I'm not going to write a pill and see you later. I'm going to write a pill and say, come back in a month. Let's look at these tests. Let's
Abs-
see what caused the problem. I'll
abs-
give you another statistic. So our lipid panel as we have it right now, there 50%, more than 50% of people who ended up with an MI had normal LDL,
mm, okay.
right?
Okay.
That is concerning because this is the number we are looking at to put people on a statin to help them reduce heart disease. What that tells you is like there's more to the picture than a regular lipid panel. So with my patients, I do advanced lipid panel because that gives you a breakdown of the different lipid particles and so then you can form this multi-dimensional strategy to address it.
Got it.
Because we do know that LDL alone is not the cause of plaques. It is oxidized LDL that forms plaques in the arteries, leading to heart disease. Now, if you just look at someone's LDL, we don't know how much of that is actually oxidized. And we know oxidation happens with formation of free radicals. And, so that's and this is
Your
functional medicine.
biochemistry coming through.
Exactly. So now it's formation of free radicals. We know it's an oxidation process. So how can we optimize your antioxidants like boost? So then when you explain that to a patient that look at your detailed lipid panel, this is how much oxidized LDL is going on. So let's have a strategy to reduce your oxidation. How can we increase antioxidants in your diet? How can we give you supplements to help this process here so you don't end up with a heart disease versus, okay, your LDL is 130. Here's a statin. See you in 6 months.
Got it.
You
Dr. Ruth,
know?
does that translate for you mentioned that you also work with women, a lot of you
Yeah.
do women's health. How does that translate for that aspect of things?
So with women, what I found, or as I learned as I got older myself, is this like fatigue
Right.
that women start having, or I started to have, whereby my blood work was normal. But then I was fatigued, like I was meeting all the criteria for major depression, which is what happens with women is as you get into perimenopause and menopause, the depletion or the fluctuation in your hormone leads to this large symptoms that we call not feeling like myself. It's
Right.
actually a term that was used in a study, not feeling like myself. And it can look very much like depression. And so a lot of women get put on antidepressants when actually the root cause could be nutrient deficiencies, could be hormonal imbalances, could be toxin that, overload of toxins or endocrine disruptors that we find in a lot of our skin products, hair products, all of that. So I realized that women were getting this diagnosis of depression when they are in their 40s, the perimenopause. And so I have, really delved into studying that and helping. So I help women with, so I make joke of it and I say I help tired women. Aren't we all? Exactly. So I'm like, well, I help tired women. And so I look at the hormones and the other thing that I think we don't talk a lot about is that we've come to accept menopause as, well, it's this what it is. There's nothing we can do. But the fact is a lot of women are getting heart disease once they hit menopause. Once you lose that estrogen protection, the risk of heart disease just doubles, right? And it's the number one killer of women,
Absolutely.
age 50. And then we look at even fractures or osteoporotic fractures. We see 1 in 2 women greater than the age 50 have an osteoporotic fracture. But what do we do in conventional medicine? We wait till they are 65 before we get a DEXA scan. So if 1 out of 2 people, so it's like we need to address these things once we start seeing the changes, and it may be as early as women in their 40s. We need to start changing how we eat, changing how we move. How can we balance the hormones so that we don't end up with heart disease and osteoporosis, fractures? Because once a woman gets a fracture, it's really, you're done. It's You've seen it in the hospital. I've seen it in the hospital. The decline is major. And then you also have the decline in muscle mass, which is really exacerbated by the deficiency in estrogen, aging, and bone loss. This is all driven by the deficiency in estrogen. And so my focus with women is that we suffer a lot after a certain age. We just Our risk for disease just jumps up, and there aren't a lot of things in place to really address that. So I do that with women in the practice. We focus on bone health, we focus on the lipid panel to optimize that. We focus on building muscle, we focus on hormonal balance, metabolic syndrome, just that whole picture for women that is really brought on in the early phase, perimenopause, menopause age group.
Okay.
Yeah.
Absolutely. So it looks like you're in your clinic right now, right?
Yes, I am.
Can you tell us where we can find you?
So I have two clinic spaces, one in Canandaigua, New York, and one in Gates, New York. And so this is where I practice out of. And yeah,
And you'll give me those addresses, and I will put that in the show notes for anyone who's interested and would like to
absolutely.
follow up with you. But Dr. Ruth
Absolutely.
was awesome today. We are so, so thankful for you teaching
Yeah,
us about functional medicine, what it looks like, what to do in order to get those physicians and practitioners that are competent and knowledgeable
correct.
about the field. So we really, really, really appreciate all you're doing, appreciate your time. It was
Yeah.
truly, truly a pleasure having you in the care room today.
Thank you so much, Dr. Cindy, for having me. I really appreciate it. And yeah, it was a good,
Absolutely. You are welcome back anytime. But
thank
guys,
you.
take a listen, follow Dr. Ruth. Can you tell us how we can find you on social media?
So, Oasis Women's Functional Medicine, we have a Facebook page, we have Instagram, and also my website is www.oasisfunctionalmedicine.com.
Perfect. Perfect. There you
Yeah.
have it, guys. Go follow. Go follow. Dr. Ruth. Until next time, take care.
All right.
Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always, always consult your personalized healthcare provider for medical guidance.